My name's Annette White. I'm a nurse on the RSU in Roslindale. And I feel that the palliative care team is useful on our unit. They definitely have helped, not just for end of life patients, but people that are in pain or need spiritual guidance to get them through the rehab process. You have to have someone that specializes in it. You can't just have, that would be like having a cardiologist, take care of a kidney patient. These people are trained. They know what to say. Not that we don't, but they have more expertise in it. A second team is like a second pair of eyes. They come in and they reevaluate. They may see things based on their knowledge and expertise again in that field to make assessments that we may not necessarily pick up as the primary team because we are treating for, a fractured hip or a knee where their eyes are going to go in a different direction.
I'm a PT. I think the palliative care team is great because it actually assists the whole team, the patient, and the family. The palliative care team brings expertise from a doctor level, the social work level, nursing level, gives care to the patients and allows the team to spend more time with them, and also helps us as therapists plan and assist, and that this palliative care team can to discuss stuff in greater detail than what the social workers could do that aren't on the palliative care team. And it also helps the therapist kind of plan and give support to us to help with different transitions and to make talking to the patients easier. Because they may bring up discussions that may not have been discussed with the family. More just estimated length of stay, or like how long someone's supposed to live, discuss what treatments do they want, and what type of treatments will they have, do they do chemo or not, can help make a transition to explain to the patient and the family what may be coming down the road, and helps the therapist plan to make treatment plans accordingly and just to give us support to support the whole patient and the team. Yes. And there have been some, and the palliative care team, I think, was actually great. There was a patient recently that was actually going to, we thought, pass away. He ended up living and actually has gone home. And I remember seeing this patient, and the son was like, "Oh, we don't want anything done." The patient ended up switching therapists because I was covering just for the day, but it didn't make a difference and made the transition easier for everyone, and to say, yes, there is life sometimes, even though these people may be declining, or if people are declining, to make life easier. So the palliative care team is great. I use them quite often and a firm believer in it. Oh, I think it's a great resource because you can find out where the patients are emotionally, the families are emotionally, how we can address it, even in having team meetings to make life easier. Some families decide, because I think families don't know the prognosis, and they did help a gentleman that we had maybe a year or two ago to make the transition easier and to make the transition to going from the rehab to long-term care. But this patient was independent, and the family really enjoyed having the palliative care team involved.
I'm Ann Masterson, and I'm the administrator of the Recuperative Services Unit here in Roslindale. I think we've seen the palliative care team's presence evolve on this unit over the years, and they really have become an integral component of our team. I think they're extremely valuable to us. We call them in on numerous occasions to help us in dealing with a challenging family, somebody who might be going in and out of the hospital and having some difficulty dealing with their diagnosis or declining health. And the palliative care team has really been fantastic to support the family, the patient, and our staff, frankly, as well. I think it's really been helpful in that they have the training and ability to help families and patients come to grips with the way in which their health might be changing and what impact that has on their quality of life. And that's really difficult for a lot of people to deal with. So the palliative care team has really been a wonderful resource to us on this unit to help us to improve outcomes for our patients and their families. One in particular, we had a gentleman who was aging himself, but had been extremely successful professionally. His wife had dementia. He was having extreme difficulty dealing with that, and in addition to that, she had other very serious medical complications. And they didn't have any children. They really didn't have any other family. This relationship was really the only thing left in this gentleman's life. And he was really struggling in dealing with his wife's decline, and I think also in dealing with what would happen to him once she was gone. He acted out against the staff a lot and blamed us for a lot of different things, and frankly we weren't really doing anything wrong. It was just he was totally struggling with the circumstances he was dealing with. And the palliative care team came in and was a terrific resource in, as I said, not only helping this gentleman deal with the decline of his wife and trying to come to terms with that, but also supporting our staff and providing our staff with some tips as to how to better handle challenging situations. Actually, basic communication skills, how to pull back, how to communicate effectively and clearly, and how not to engage in certain situations that we knew that this individual was going to try to draw us into. Helping us realize that it was okay to set some appropriate limits, to reiterate our policy around respect, but to do that in a kind and empathetic way. They were tremendously helpful to our staff and actually always have been. One other way in which the palliative care team was incredibly helpful and supportive to our staff is several years ago we had something very tragic happen on this unit. We had a gentleman that we were caring for. He was making a lot of progress. He was doing really well. As a part of his treatment plan, had gone out for a leave of absence to his home, and that was so successful. He came back feeling stronger and really looking forward to his future. He wanted to go again. The second time when he went, he actually committed suicide when he was in his home. That was devastating for our staff, and if it weren't for the palliative care team and the support they were able to provide to our staff, that would have been really difficult for us to get over, because we were really just trying to follow this gentleman's wishes. We were very professional in the way we had handled everything with him. He was really doing very, very well. And the staff took this so personally and felt at fault and felt that we did something by helping him get stronger, that we were actually responsible for the outcome, for him taking his life into his own hands. And the palliative care team, I will never forget it. They were there for us. They provided around-the-clock support to our team. Training that we don't have as nurses or therapists or administrators. We don't have that specialty training. So it was really incredibly helpful to our team. And as an administrator, I was really thankful that Hebrew SeniorLife was willing to put that resource through the palliative care team on our unit and to make it available to us.
I'm Kathleen Daskell, nurse practitioner at Hebrew Rehab. So the palliative care team resource is invaluable in the sense that they provide additional resources for families mostly to help them make decisions for continuity of care and to support them in those decisions. It becomes a challenge for a lot of families when there's changes in health status for their loved one to make the decisions, and they provide, the palliative care team itself provides additional resources for providers too to have an additional resource to say to give varying opinions to help them in the family and decision-making process. The additional team resources from a nursing and a case management perspective and chaplaincy as a team, as well as the resources for pain management as well is really helpful. I have used, I would say the most valuable aspect would be where to keep patients out of the hospital as well by helping the families make these choices. The one with the okay, so we had a 93-year-old male who came in, had a bowel surgery that left him with a new ostomy, actually 2 new ostomies. And the patient went through with the surgery, but ultimately was not able to eat. And his biggest decision was the fact that he was intact, competent to be making decisions for himself, and he really did not want to live like that. His quality of life was significantly impacted, and the daughter and the son had a lot of challenges, and the palliative care team was invaluable in helping this daughter and the son make decisions that and being in line with the father's choices, and helping him to have his needs met and their needs met, and facilitating this end of life process. For sure, to have the palliative care team is for a family like this who's making these big choices. I think there would be so many more patients that would go back to the hospital and look into different resources, and the palliative care team would be consulted in that setting. So to keep them in place, have the palliative care team available here, and to help with these decision-making processes and optimizing quality of life at the end of life, or if it is to continue to stay out of the hospital.